Dermatophytosis is also called as ringworm, tinea. Three genera of dermatophytes infect skin, hair, nails. Microsporum does not infect nail. Epidermophyton does not infect hair. Trichophyton infects all three areas. Need to remember, in the English alphabet, M and N are close. Microsporum does not infect nail. E and H are close. Epidermophyton does not infect hair. The fungi persists in the corneum mainly as it is a keratinophilic fungus. Typically, it causes annular lesions, ring lesions, with peripheral scaling which spreads outwards. Central clearing indicates annular lesions. Annular lesions, active water, central clearing, tinea, annular lesion. High yield points, central clearing equal to tinea. Central crusting, leishmaniasis. Central scarring, lupus vulgaris. Most common organisms are all tinea apart from tinea capitis. Most common organism is Trichophyton rubrum. Tinea capitis. In India, most common is Trichophyton violaceum. In US or UK, most common is Trichophyton tonsurans. In Europe, most common is Microsporum canis. Most common tinea in India is Tinea corporis. Most common tinea in the world is Tinea pedis. Tinea capitis. Invasion of the scalp hair shaft. Clinical features: it is disease of children, rare in adults. Patchy alopecia occurs, either inflames the scalp, that is inflammatory tinea capitis, or does not inflame, non-inflammatory tinea capitis. All MCQs, high yield points, all MCQs on tinea capitis will have a child in the question. Pick up phrase in the MCQ: easy pluckability of hair or broken hair. Okay, classification of tinea capitis: endothrix, fungal spores inside hair shaft. Endo is end, thrix is hair. Ectothrix, fungal spores outside the hair shaft. Ectothrix, endothrix. Non-inflammatory type, inflammatory type. Non-inflammatory type causing non-scarring alopecia. Black dot endothrix, organism is Trichophyton violaceum, Trichophyton tonsurans. And here inflammatory type causing scarring alopecia. Carry on either ectothrix or endothrix. Organism is Trichophyton mentagrophytes, Trichophyton verrucosum, Microsporum canis. Figure 11, tinea capitis, black dot, multiple black dot, hair broken at scalp surface seen with non-scarring hair loss. Clinically, due to fungal spores inside the hair in this endothrix variety, hair becomes weak and breaks right at the surface of scalp as they grow up. These broken tips are seen as black dots. Figure 12, tinea capitis, carry on. Boggy swelling with pus discharge and matted hair. Clinical painful inflammatory boggy swelling with pus and sinus formation. Non-inflammatory type, we have grey patch, ectothrix. Organism is Microphyton. Organism is Microphorum ferruginum, Microsporum canis, Microsporum audoni. Flores under woodlamp, green color. Inflammatory type favors endothrix with air spaces inside hair. Organism is Trichophyton schonleini. Clinical concave yellow cup-shaped crush called scutula form on scalp. The fungus is inside the hair and forms air spaces. Figure 13, tinea capitis, woodlamp of grey patch, greenish fluorescence. Clinical grey colored areas of alopecia with scales, hence called grey patch. Broken hairs breaking 3 to 4 mm above scalp surface. Figure 14 favors note yellow colored cup shaped scutellum with scarring alopecia. 8 to remember organisms causing endothrix. TV is seen in the house. Trichophyton tonsurans, V. violatium in endothrix in the house. Black dot, black means dark, that is no fluorescence. Grey cats are ferals. Grey patch dot is caused by Canis and Ferruginum feral species. Men can be very red. Mentagrophytes, Canis verrucosum cause red inflamed lesions. Carry on. Treatment: Microsporum species, grey patch, and some types of carrion. Oral griseofulvin is drug of choice. Trichophyton species, black dot, favors, and some type of carrion. Oral terbinafine is drug of choice. If species not mentioned in, mark oral griseofulvin as drug of choice. Tinea barbae, ringworm of the beard. Tinea facie, ringworm of facial skin. Tinea manum, ringworm of the hands. Tinea corporis, Tinea circinata equal to rings. Tinea glabrosa, ringworm of skin other than scalp, beard, face, hands, feet, and groin. Tinea manum, annular plague on the hand. Tinea facie, annular scaly plague on face. Tinea corporis, annular ring lesion on abdomen. Tinea pedis, athlete's foot. Tinea pedis is associated with increased sweat on foot and increased use of closed footwear. It is of three types: interdigital, scaling and itching in between toes, especially lash web. The sweat between the toes has a high pH, and damp keratin is a good culture media for the fungi. Figure 17a, Tinea pedis, interdigital, scaly plaque between toes. Note the first web, most open and ventilated, hence dry, is yet to get involved. B is moccasin foot, diffuse plantar scaling. Moccasin foot, chronic plantar scaling type. Bullous type causes severe inflammation, creating blisters. This is caused by Trichophyton interdigitale, formerly called Tinea mentagrophytes. Tinea cruris, jock itch, crotch itch, dobby itch. Ringworm in groin, most commonly seen in males. Figure 18a, Tinea cruris with corporis, erythematous scaly annular plaques in groin and abdomen. Tinea cruris, annular lesions with peripheral scaling on inner thigh and groin. Onychomycosis, Tinea unguium, ringworm of the nail. Clinical features: yellow discoloration of the nail, thickened nail plate, subungual hyperkeratosis, tunneling under the nail plate, tunnels in the subungual hyperkeratotic tissue. Types: distal and lateral subungual onychomycosis, most common type. Distal plus lateral nail plate and nail bed involved. Superficial white onychomycosis, only nail plate superficially involved, no nail bed involvement, most common in HIV patients. Proximal subungual onychomycosis, proximal nail plate and nail bed are involved. This is also most common in HIV patients. Totally dystrophic onychomycosis, complete destruction of the nail. Proximal Figure 8, distal and lateral subungual onychomycosis. B is total dystrophic onychomycosis. C is superficial wide onychomycosis. D is proximal subungual onychomycosis. Figure number 19a, onychomycosis, yellowish discoloration of distal edge of nail. B is thick nail, subungual hyperkeratosis. Tunnel formation is green. Hyperkeratosis yellow arrow, tunnel formation green arrow. C is onychomycosis, no, the friable subungual hyperkeratosis, onycholysis in yellow nail plate. D is distal and lateral subungual onychomycosis, no, the yellow discoloration of nail plate. Treatment: fingernails, oral terbinafine 250 mg per day for 6 weeks. Oral itraconazole pulsed dosing 400 mg per day for 1 week of each month for 2 months. 2 nils. Oral terbinafine 250 mg per day for 12 weeks. Oral itraconazole pulsed dosing 400 mg per day for 1 week of each month for 3 months. Topical treatment with amorolfine and cyclopyroxolamine can be used in mild nail infections. Tinea incognito means no cognition, that is not to not be able to diagnose easily, a term applied to atypical clinical lesions of tinea, usually produced by incorrect treatment with a topical corticosteroid. Since steroids suppress inflammation without treatment of fungus, lesions may be asymptomatic and extensive and may even lack scaling. Often long-term steroid application create hypopigmentation and striae. Figure 28, tinea incognito. Note the tinea yellow arrow and striae red arrow due to steroid abuse. This was a case of tinea corporis incorrectly treated with topical steroids. Investigations in tinea: KOH smear from scales, nail plate or tissue under nail, loose hair, fungal culture and subrod dextrose agar. Revision: it is caused by microsporum, if it is caused by microsporum, it does not infect nail. If it is caused by epidermophyton, does not infect hair. If it is caused by trigophyton, infects all 3 areas. Annular lesions with central clearing. Most common cause of all tinea except tinea capitis is tinea rubrum. For tinea capitis, which is equal to tinea violacea in India. Tinea capitis, easy pluckable hair in children, causing patchy alopecia, broken hair, grey patch and fevers, fluorescence and woodlamp, black dot, carrion. Terbinafine is the drug of choice for all tinea. For tinea capitis, griseofulvin is the drug of choice.